It's very important coaches and teams are ready for any type of injury.
So today, Bryan Health hosted a training session on emergency scenarios ahead of the fall sports season. Channel 8's Philip Catalfamo was there. He joins us now. Tell us about this important demonstration, Philip.
Thank you. Playing sports can be a fun and exciting experience. However, in a matter of seconds, an injury can quickly change that mood. Thankfully, there are people on the sideline prepared for such an event.
Are you okay? Can you hear me?
We're just a few weeks away from the fall sports season. From the Huskers to local high schools, fans will flock to their favorite venue to cheer on their team. And while we are all ready to watch our favorite teams go at it on the field, safety is very important. Today, Bryan Health welcomed local athletic trainers, emergency medical personnel, and athletic directors from local schools to Seacrest Field for training on several techniques that can be used to diagnose and treat illness and injuries.
Obviously, the focus, of everyone's attention is football and the contact of that. But some of the things that we're going to be focusing on can happen, in any sporting events.
Crystal Kerr says proper communication is key when things go wrong on the field.
Being able to communicate effectively is something that's important, and I think something that we're also talking through and working through. Better communication, maybe even having some walkie-talkies and earpieces and stuff to be able to communicate with, admin or, that type of stuff that can be a little bit quicker in reacting so that, one person isn't running back to the sideline and then running back out.
Last July, the Athletic Training Practice Act was updated, allowing athletic trainers to administer emergency medications like an epi-pen, asthma inhaler, or narcan once rules and regulations are finalized. Cassie Metzner, athletic trainer of Waverly High School, says this change is huge.
Before, it would have to be prescribed to that athlete, and that would be the only person that we could actually use that prescription on. Now we would be able to get an emergency use prescription, so we could have it on us for, if somebody's having an asthma attack but doesn't actually have an asthma inhaler, we'll be able to administer that right away.
The event is also a great chance to network or catch up with some colleagues. Athletic Training Education Program Director Samantha Wilson of Nebraska Wesleyan University comes to the event every year to keep up to speed on new changes.
We don't see all this every day, so practicing is extremely important, and at least practicing it annually is important. And our number one goal is always the safety of the athlete, so making sure that we're prepared in an emergency situation is most important.
Now, Metzner says the most important thing an athletic trainer can do is remain calm and level-headed, especially in these situations. Back to you.
Like you said, seconds count. All right, thank you so much, Philip.